Okay, hi. How are you guys doing? I hope everyone are doing fine. So once again, welcome back to our channel, Medicine Moms. Actually, we were discussing regarding some anatomical portions which were dealt by Vidya. So hope everyone has gone through that. If any doubts, don't hesitate to contact us, or you can either mail us or you can put your comments in the comment box. Okay, so today we'll be dealing regarding the conventional general coding guidelines, which are very important before starting the actual coding classes. Like means the chapter wise coding guidelines. Before starting the chapter wise coding guidelines, we'll just deal with the conventional guidelines which is applicable for all the chapters. Okay, so in that I'll be discussing almost 10 to 12 topics, like subheadings will be there. The first one will be like alphabetical index and tabular index, and the second one is like format and structure. In alphabetical index and tabular index, this is something what how your book looks like. Okay, you guys understood or what? Means how your ICD textbook looks like. That is the complete thing what comes in alphabetical index and tabular index. Mainly your book is divided into two, and in that the initial portion is the alphabetical index and the remaining portion is the tabular index. Okay, so as the name describes, alphabetical index means all the things consisting in that falls in order like alphabetical order, in order like alphabetic. Okay, so in that mainly there are four sessions are there are four subdivisions in that alphabetical index. The first one is like diseases or injury. Means for example, if you want to check bronchitis is the diagnosis which you need to code. Then what you will do, you will go to the alphabet B and then you will find out for bronchitis. Okay, so likewise what all the diseases and the injuries are there, that will come under the initial portion of your ICD book, that is diseases or injury. Okay, then the next column is like external causes. Once after the diseases and injury finishes, the next portion is like external causes. External causes means like for example, I'll tell you one person met with an accident in the main road and all. Means what is the external cause over there? Met with an accident in the main road. Okay, so that is the external cause which comes over there. So for these codes, we can't identify this from the diseases or injury section. You need to find it from the external cause section only. Okay, so when you get like injury codes and all, you will be primarily coding the injury, and along with that, if you get the scenario like patient had a fall in the playground, all those things, first you will be coding your injury, then after that you will code the place of occurrence. Okay, this comes under the external causes. So for the place of occurrence, where playground, for the playground you will go and you will code from the external cause sessions. Okay, don't worry, I'll show you the book how to handle it, that we will upload very soon. If possible, I'll attach it as back of this video or as a next session video. I'll upload it, okay, so that it will be more clear for you guys. And next one is the table of neoplasm. Neoplasm, that term itself clearly says that neoplasm related conditions or cancer related conditions will come under this particular thing. Okay, so for example, if you have gotten diagnosis like CA breast, okay, cancer of breast, in that cases you need to go to the table of neoplasm. If you go in the table of disease or injury also, you will get it, but like more specifically you will get the code from table of neoplasm. You can go there, then you will be able to find out in which quadrant the CA is, all those things you will be able to find out, whether it is a primary cancer, secondary cancer, all those things you can get it in detailed way in the table of neoplasm. Okay, then the next one is table of drugs and chemicals. What is this drugs and chemicals? Table of drugs and chemicals means, for example, if a baby is coming with an acetaminophen poisoning, okay, in that case what we need to code? Acetaminophen poisoning. Poison has happened because of acetaminophen. So you will go and open your drug and chemical table and then you will find for acetaminophen. And in that there are some subcategories like poisoning, adverse effect, intentional harming, overdosing, all those subcategories are there. In our scenario, what I have told is overdosing, poisoning of acetaminophen. So you will go for acetaminophen, then you will select poisoning, then you will get a particular code from there. Okay, so whenever you need to code something related to the drug and chemicals like this, like adverse effects, poisoning, all the scenarios when you need to go and check in your table of drugs and chemicals, then you'll be able to find it out. Okay, so these are the main 4 things which comes under the alphabetical index. The first one is the disease or injury, the second one is the external causes, then comes the Neoplasm table, and the fourth one is the drugs and chemical table. Okay, so now what is the importance of this tabular index? Okay, this is based on the body system or the conditions. That means system wise it is arranged in the tabular list, but in the alphabetical index it is arranged in alphabetical order, where in the tabular list it is arranged in system wise. Okay, so what is the correlation between this alphabetical index and the tabular index? As I have told you, in the first sentence, disease of injury, I told you, you may get a diagnosis like bronchitis. For example, you got a diagnosis like bronchitis and you need to code for it. You went to your alphabetical index, you picked the code for bronchitis. Okay, that doesn't mean that it is a confirmed code. When you need to confirm a diagnosis or a particular code, you need to go back and refer to your tabular list, and then only you should confirm it, because the specifications comes in the tabular list. In alphabetical index, they will guide us where to go, how to go and all. Once you pick your code from there, you will go back to your tabular list and you will make confirmation by seeing that particular code in the tabular list. Okay, so tabular list is very, very important. Without tabular list, you can't confirm the codes. Okay. So this is the alphabetical index and tabular index. Next comes the format and structure. What comes in format and structure? In format and structure, there is a basic format what we need to follow when we are writing this ICD codes. Okay. If you see here, it's written like T81.718A. Okay. What is this T81.718A? We'll get a particular diagnosis and we'll write in this format. For that you should know what does this what does this T stands for, 8, 1, this dot stands for. We need to know what does it stands for. Okay, so that it will be very easy for you guys to analyze it. This T81.1, that means 1, 2, 3. The first 3 letters indicates the category code. That means for which system does it belongs. That gives us an information like for this which organ system does it belongs. Okay, for example, if you are getting a code from J series like J20, J21.9, all those things, if you are getting, it's understood that it is from a respiratory system. So this initial 3 letters indicates the category code. Okay, and also you should remember always the first digit will be alphabetic. It will not be numeric. Okay, so make sure. Sometimes in ICD there are 10 mark questions to identify the from the general coding guidelines. You may get like codes written like 8T1 and they may ask you to pick the correct format for the code. In that case, you can easily eliminate that one. Where there is no T code not T code, where there is no alphabetical code as primary, you can easily eliminate that options. Okay, so the first 3 things stands for the category code. Okay, so in this format and structure, the minimum code requirement is 3 and the maximum is 7. Okay, for example, if there is only 3 codes, 3 places, we will not put this dot. Okay, but if there is 4 letters which we need to put, in that case we'll put a dot in between to separate the category code and the extensions. Okay, for example, I'll tell you, if the code is like R05, okay, R05 which indicates cough, that means there is no more extension for that particular code. In that case, we'll write R05 and we'll not put a dot after that. Okay, that means that R05 is a complete code. If we put a dot, that means that is an incomplete code. Okay, then comes the 4th place. 4th place is the etiology. What is etiology? Etiology means the causative factor. Okay, or the because of what the condition has happened or how the condition has happened. That is what called as etiology. Okay, so in the 4th place the etiology comes. Then 5th place is the location. Location means on the which anatomical part we got affected. Okay, Means if it is in our shoulder, shoulder. If it is in the leg, means we need to indicate it as leg. Okay, so that is what comes as the fifth place. In the sixth place, it comes as the laterality. Okay, laterality means whether it is a right or left. Now you will ask what is the difference between then this the fourth and the fifth character. Okay, sorry, fifth and the sixth character. In the fifth character, it says the location. That means that in the which anatomical portion is that particular condition affected, and laterality gives you more specification. Okay, for example, if the patient is coming with pain in the right shoulder, the fifth place indicates the shoulder and the sixth place indicates the right shoulder. Understood? So this is the difference between the location and laterality. Location indicates the anatomical location where we got affected, and laterality is differentiating whether it is a right or left or bilateral. Okay, so the third point is seventh character assignment. As I have told in the format and structuring, the seventh character is kept for an extension which gives us an elaborated description of that particular code. Okay, so in the seventh character, mainly we will discuss regarding A and D. And there are many other 7 characters also, like K, all those things which comes in fracture chapter. We'll discuss that in chapter wise guideline. Okay, so the main 2 things are like A and D. A indicates receiving active treatment. Okay, that means the patient has come for receiving an active treatment. In that cases, we will use the 7th character as A if there is a requirement for that particular code. Okay, how you will come to know the requirement? When you select the code from the index list and when you are going to cross check it in the tabular list, there will be an indication given. Kindly use the 7th character. Okay, from that, at that time, reading the scenario, you can choose whether it is an active treatment or a routine care given after an active treatment. Okay, so now what is an active treatment? For example, if the patient has come with some other infection and doctor has advised to take antibiotics for 6 weeks. Okay, in that case, that particular scenario falls under an active treatment. Understood? That means the patient is taking ongoing treatment. That is specially known as the active treatment. Then what is alphabet D? After receiving active treatment, now patient is coming for a routine care. And that means simply you will understand when we talk about the fracture care. For example, if the patient has undergone some tibial fracture or something, patient was hospitalized. After that, patient discharged. After the post-op procedure without any post-op complications and all, patient got discharged. After discharging, the patient will anyway get discharged with a cast and all, right? So patient is coming for the cast follow-up and all. In that case, it falls as routine care. Okay, so in that particular scenario, we'll choose the 7th character as D. So the main thing is you need to understand the difference between the active care and the routine care. Active treatment means currently the patient is taking treatment for that particular condition. That means actively the disease condition has not subsided. It's still ongoing and patient is taking treatment for that thing. Routine care means everything was healed and patient is coming for a follow-up. Okay, so that is routine care. So that is alphabet A and alphabet D. Now comes the placeholder character. Placeholder character is X. Okay, in ICD, whenever you see an alphabet X, you should understand that we are using a placeholder character. See, I have written here as used in empty spaces. When you will go back to the first slide, first board written, which in the first board which I have written, one ICD code I have written, right, with 7 characters. For example, if we don't have a 6th character to put, what was our 6th character meaning? That is the laterality. We don't know the laterality, but we have an extension with us. In that case, we will put X in the 6th character place. Is it clear? I'll tell you once again. We have a complete code of 7 characters, but our 6th character or 5th character is missing. That means we don't know. Okay, but the 7th character is available. We can't keep our 5th and 6th character place empty, right? So in that place, we will put X as a placeholder. That means this particular place will be expanded later. Okay, that is placeholder. Then abbreviations, not else, NEC means not elsewhere classified, and NOS means not otherwise specified. NEC and NOS. NEC diagnosis is very common and we get very frequently. In NEC, the diagnosis is very clear. Okay, the physician has documented the diagnosis very clearly, or the statement given by the physician is very clear, but we are not able to choose a code, or we are not able to get a code, like it's not there in our book. Okay, in that cases we will choose NEC, like not elsewhere classified diagnosis. Okay, but the condition given by the doctor is very clear, like patient is having that particular condition only. Okay, mainly we get in the gastrointestinal system when we go, we get mainly this NEC classified diseases. Okay, we should be very careful while assigning. We should cross check whether it is confirmed. For example, if the doctor is putting as a query and all, if you code this NEC diagnosis, then it will be a big mess. Then in that particular scenario, you need to raise a physician query to that particular treating doctor, and you should confirm whether this is a confirmed diagnosis or not. If it is a confirmed diagnosis, and if you don't have any other option, that means we are forcefully choosing a diagnosis. If you don't have any other option, you can select this NEC diagnosis. Okay, then what is NOS? Not otherwise specified. That means it is not clearly documented. It is either not clearly documented, or doctor is not sure about that particular condition. That means it is a queried condition. Doctor is not sure about the condition which is mentioned, or it is not clearly specified in the medical documentation. Okay, so this is the NEC and NOS. The most commonly used thing is NEC. In NEC, it is very clearly specified what is the condition of that particular patient. Okay, so we can use, we are not able to get any other diagnosis. That is the only reason why we are using NEC diagnosis. Okay, so the sixth point is punctuations. In punctuations, actually there are 3 to 4 points, like square brackets, slanted brackets, colon and parenthesis. When we talk about the square brackets are nothing but which are the synonyms which they are giving. In the square bracket, they may be giving us some synonyms, okay, so that we can easily understand, okay, this can be the condition. Okay, so whenever something is given in a square bracket, you should check whether it suits to the particular diagnosis which is given to our condition. Okay, according to our scenario, if it is matching, then we can take from the square bracket. The main thing is, whenever you are doing coding, you should make sure that you are following all the instructions which they are giving, like the notations which they are giving. You should be very specific to the notations. If you miss any of the notations, your answer may go wrong. And if you don't know the exact guideline, and if you follow the notation also, you may reach to the actual code, actual answer. So make sure that you are following the notations properly. So the next one is the slanted bracket. What is slanted bracket? Whenever you get a notation in a slanted bracket, make sure that there are 2 codes in that particular scenario. In slanted bracket, they indicates the manifestations, and always remember that whatever is given in the slanted bracket will not come as the primary diagnosis, it will stand as the secondary diagnosis. Okay, it is nothing but giving an indication for the manifestation, and you can easily identify that there will be 2 codes if there is a slanted bracket. Okay, then what is colon? Colon is nothing but if the word or the particular term is incomplete. In that scenarios, there will be a colon given to that particular diagnosis. That means you need to add something else to complete that particular term or that particular condition. Okay, so whenever a colon is given, you can easily identify that that particular diagnosis is not complete. We need to add something else to that. Okay. Okay, then what is parenthesis? Parenthesis is nothing but whenever there is a parenthesis, it gives us a supplementary word so that we can go and refer for further clarification of the code, which will be giving us a correct proper diagnosis. So when you get a parenthesis, make sure you are referring for the supplementary term. That means it's providing us an additional information. So these are the main things comes under punctuation: square bracket, slanted bracket, then colon and the parenthesis. Then the next one is others, other and unspecified. Okay, other specified or unspecified. What is other specified and unspecified? It's nothing but NEC, as previously I told, not elsewhere classified. That means it is sometimes it is unspecified means nothing is clearly specified. Other specified means something is specified but it is not accurate. That means it is not a confirmed or a definitive diagnosis. In that case, we will say it as other specified. Unspecified means nothing is specified. Okay, but the documentation is clear for that particular given diagnosis. Understood? And the next one is the inclusive note. What is inclusive note? When we take one diagnosis, there may be some subcategory diagnosis mentioned under that particular diagnosis, like chronic bronchitis and all. When you check for that particular diagnosis, under that they may give like chronic tracheobronchitis. Actually, the first diagnosis and the subsidiary diagnosis, there is no correlation between this. Okay. Still, they say that it is an inclusive of this particular diagnosis. So, when you get an inclusive diagnosis code, you should not code that inclusive diagnosis separately. Understood? Means, for example, as I have told, if it is a chronic bronchitis, under that, if you get like chronic tracheobronchitis, if the patient is having both bronchitis and tracheobronchitis, you will not code bronchitis and tracheobronchitis separately. You will only code that chronic bronchitis. Understood? So, whatever comes under an inclusive list, the primary diagnosis which is given, you will select only that one. You will not code the following diagnosis. Okay, that is inclusive notes. Now comes the excludes notes. It's very, very important. Excludes 1 and excludes 2. I'll give you one simple example. Excludes 1 is nothing but contradictory conditions, we will not code it together. The very simple example is congenital conditions or acquired conditions. We can't code congenital condition and acquired condition together. What is congenital condition? Congenital condition is nothing but which is occurred by birth. At the time of birth itself, we have that particular condition, and so that is the only reason why we can't code that particular condition as acquired. What is acquired? During our lifespan, we get that particular disease. That is called as acquired condition. So, congenital and acquired conditions we can't code together. This is called as excludes 1. And what is excludes 2? Excludes 2 means the two different conditions which may occur together. Okay, maybe it is related to the same anatomical location, but still we can code it. I'll tell you one example, something like portal vein thrombosis along with that hepatic vein thrombosis. Okay, what happens when there is a portal vein thrombosis or hepatic vein thrombosis? Hepatic vein thrombosis means the blood is carried out from the liver, and portal vein means blood is coming to the liver. Okay, so actually when we look into the anatomy, it's actually the location is same, but still we can code these both diagnoses together. Okay, so this is called as excludes 2. Excludes 1 is something like the contradictory conditions we will not go together. Excludes 2 are like both the conditions may occur together for the patient. In that conditions we can code both of them together. Okay. Then the next one is code first. What is code first? As I told, when we select some diagnosis, there will be notation. Now you will be thinking, where do we get these notations? Once you select your codes from the index list, you will be going and confirming your code in the tabular list, isn't it? So when you confirm that in the tabular list, there you will get all the notations which I am telling. Okay, so when you code this one, they will clearly mention as code first the underlying condition. For example, if the patient is having any dementia, okay, patient is coming for dementia, and the root cause of dementia is Alzheimer's disease. Okay, in that case, they will clearly mention as code first. Okay, in that case, what we'll do? We'll code Alzheimer's as the first primary diagnosis and dementia as the secondary diagnosis. This is nothing but code first. So now I hope that you understood the importance of notations, right? So if you see a code first notation, make sure that what is the underlying condition given. Based on that, you should change your principal diagnosis and your secondary diagnosis. Okay. Then the next is use additional code. What is use additional code? code first means I told you should select it as the principal diagnosis. Now what is use additional code? When you select a particular code, there will be a notation given like use additional code for, okay, complete the diagnosis. If we take an example for urinary tract infection, when we code for urinary tract infection, when you go to the tabular list, we'll get a notation like use additional code for indicating the causative organism. That means the UTI is due to which organism, which bacteria, what is the actual causative organism. If we code that causative organism along with that, then only that particular diagnosis will become complete. Okay, so this is something called as use additional diagnosis. Okay, so the notations are very important. You should make sure that you are checking for it. Okay, then C and C also. C and C also means in C, when you look for C, it is an indication given for the coder that you should specifically look into this diagnosis code. That means there will be something information leading for a clear diagnosis. Sometimes when we choose the code, it may be like other specified or something, but when you go to notation, C notation, you will be able to lead to your correct diagnosis code. Okay, so C means it is an alert for the coders. You should go and check it. It's very mandatory. Okay, you should go and cross check for the same thing. C also, it's not mandatory, it is also an alert, but we can just choose it. It just gives us a lead. Okay, but we can decide, okay, whether this code is apt or the previous one which I have selected. It is up to us. But in C, it is a clear alert that coder is supposed to check this one. If not, the code may go wrong. Okay, so this is the difference between C and C also. So the last point is like relational terms. In that we have 3 points, and, with, and, due to. In this due to is very important. And means along with. Okay, that means something along with this. And when it comes to with, it is associated with. This particular condition is associated with the other one, or the manifestation will be clearly mentioned over there. And when it comes to due to, that means the primary diagnosis is due to some or the other underlying condition. For an example, it's due to is very important. Okay. For an example, if the patient is coming with hypertension, along with that the patient is having CKD, chronic kidney disease. Doctor has documented as hypertension since so many years is specified, and CKD since 1 or 2 years doctor has mentioned. In that case, as a coder, what you are supposed to check? You should ask the doctor whether this CKD is associated with hypertension. If it is so, then we need to code hypertensive CKD. Okay, understood. This is nothing but due to. So we need to check for the documentation given by the doctors very clearly. If it is due to diagnosis and if it is not documented properly, we need to raise a physician query to the doctors and we need to clarify the diagnosis. Okay, so these are the main points which we have discussed today. Mainly like alphabetical and tabular index, then comes the format and structure, then what was the thing like 7th character, placeholder, then what we discussed, includes and excludes we have discussed, punctuations we discussed, then includes and excludes, use additional codes, code also, all these things we have discussed today. These are the conventional guidelines which comes under ICD 10CM. Okay, so hope it was clear for everyone. If something is missing or if it's not clear for you people, just don't hesitate to mail us at millicentmom08@gmail.com. We'll get back to you guys. Okay, so keep on watching us. Please like, do share and subscribe us. Okay, bye.